My name is Dr. Chi Chen. I'm one of the nephrologists at the Division of Nephrology and Hypertension, Department of Medicine at Mayo Clinic, Rochester. It's a great pleasure to introduce my paper, which will be published in the August edition of the Mayo Proceedings. The title of the paper is Dysmagnesemia in Hospitalized Patients, Prevalence and Prognostic Significance. So magnesium is a multifunctional cations, one of the second most abundant cations in the cell, in any human cells. It's a critical cofactor for over 300 intracellular reactions. And one of the major contributions that magnesium exerts is the energy production, cellular energy production. We looked at the immediate past 5 years data from 2009 to 2013 because there has been no prior studies comprehensively look at the prevalence and clinical significance of dysmagnesemia in hospitalized patients. We investigated a total of 65,934 admissions. These are unique admissions to Mayo Clinic, Rochester. And we found less than a quarter of these admissions had a optimal magnesium, serum magnesium concentration on admission. Importantly, both high or low magnesium concentration on admission predict the risk for hospital mortality, longer hospital stay, and the discharge for being discharged to a care facility. The previous studies has found most of the patients with magnesium alterations usually have hypomagnesemia, and higher magnesium level is considered rare. Our study show that the pendulum seems to have swung from low magnesium to high magnesium in sick patients. One of the underlying reasons could potentially be large number of papers reporting the detrimental effects of hypomagnesemia and more appreciation of hypomagnesemia that could lead to a common use of magnesium. For patients admitted with respiratory disease, twice the number of patients with hypermagnesemia than patients with hypomagnesemia. That could be related to many publications showing that magnesium could relax airway smooth muscle cells, could also modulate the immune system, and has anti-inflammatory effects. All these effects could could be beneficial for patients with asthma and severe pulmonary obstructive diseases. There are some limitations in the study. This is a retrospective observational study. Future studies in a prospective randomized interventional trial design could further confirm our findings. So the take-home message from this study is that for patients admitted to the medicine it might be worthwhile to have an admission magnesium level so that we could identify these patients. Additionally, for patients without evidence of magnesium deficiency, our study results show that supplementation should be avoided. Thank you for letting me presenting our study results.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.